What's up, Z-Pack? It's your boy, ZDoggMD, aka Dr. Zubin Damania. I'm live and direct out my kitchen. Don't ask why. For supporters of the show, members of the Super PAC who subscribe for $4.99 a month, by the way, you can click the little button to subscribe if you want to. This afternoon, we're going to be broadcasting live from Studio Z, doing some behind the scenes about how we edit videos, because today we're editing a music video about flu testing, I should say. So make sure to tune in then. You'll get a little notification if you're a supporter. And if you do support the show, thank you for helping us remain independent and Oz-free. You know what I'm saying? All right. I don't know about y'all, but every time Apple comes out with the new gear, I gotta kind of tune in and see what's up, because I kind of make part of my living using Apple devices. So when I see something new come out, I either get excited, bored, or angry. And all three happened today. So far with what we've seen, they got this big new iPhone that I don't think will fit in my little T-Rex arms. And they got a new Apple Watch, which I thought was really interesting. And I will tell you, hi Nicole, she's a supporter, Cynthia's a supporter. I'll tell you why I was interested in Apple Watch. They started talking about it, oh, it's a bigger display. By the way, I miss Steve Jobs so much. I miss him so much. He used to make these things so dope. Look, and one more thing. And by the way, I think it's still going on, so I haven't finished the broadcast. Who knows what the surprise is? It's all been leaked anyways. But when Steve Jobs did it, it was dope. Now it's just like a bunch of like dudes up there and girls up there going, well, this new processor is really fast, and I think in China they're really going to love this gold color of the phone. I'm like, dude, Steve Jobs he is rolling over in his grave. You people need something called charisma, and yes, that's how it's pronounced. All right, so the new Apple Watch comes out, and immediately the doctor in me, and I know some of the medical folks at Apple who are working on this stuff, but I haven't talked to them about this stuff. It now does a couple of fascinating things that bring it into the realm of a medical device, so much so that they got FDA approval to sell it over the counter as a kind of medical device. And this is what it purportedly does now. It's always kind of checked heart rate using an optical sensor on the back of the band. Now it'll do that, but it has an algorithm that will detect an irregular heartbeat and be able to recognize it presumably as atrial fibrillation. So that's one thing that it does. Now, for those who don't know what atrial fibrillation is, a normal heart rate, which we call normal sinus rhythm, is a regular heart rate, and it happens because the atrium, the top of the heart, there's a sinus node there that's a little electrical node of tissue. It sends a signal down to the AV node, which then puts a little pause on it. The atrium contracts, that first part of the heart there, and that shoots blood into the ventricle. Because that AV node puts a little pause on the signal, there's a little delay, then it gets to the ventricle, and the ventricle squeezes, and that's where the blood goes either to the lungs if it's the right ventricle, or to the body if it's the left ventricle, and the brain via the carotids and the aorta and all of that. So in a normal heart, normal sinus rhythm, these are very synchronized activities. The sinus node fires, the electrical impulses go regularly, squeeze the atrium, pause at the AV node, then squeeze the ventricle, right? In atrial fibrillation, what happens is the atria itself have this chaotic electrical activity, and the sinus node no longer is in charge. And since it's doing this, it's fibrillating. The little fibers in the atrium are going blah, 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 instead of quick, quick in a coordinated way. Do you like my sound effects? So as a result, the atria is chaotic, so it doesn't properly squeeze blood into the ventricle. Well, it turns out that's not a huge component of your cardiac output anyway, so most people can do okay without that little bit of what we call atrial kick. Some people who are on the border actually don't do okay with it, and that's a discussion for another time. But the main problem with atrial fibrillation is because it's doing this, it's crazy chaos electricity, the AV node, that part there that put the pause on it, it can get overwhelmed, and a lot of different impulses can get to the ventricle to the point where the ventricle is squeezing, number one, irregularly. So instead of dum 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 dum, it's like kind of chaotic. So irregular is one thing, but the second thing that can, so some of those squeezes are full of blood and great, but some of them don't have a chance to fill yet. So you're firing like a blank. So you really kind of can mess up your cardiac output, and people can feel it in the form of palpitations in their chest, dizziness, lightheadedness, low blood pressure, and worse problems from there. So that's one problem. The second problem is it can go too fast. So now the ventricle doesn't have a chance to fill at all. So if you're going in atrial fibrillation, it's irregular at 160 beats per minute, roughly, because it's changing all the time. You could have trouble, right? And so as a result, that fast heart rate's a problem. But the second problem about atrial fibrillation, and the reason you want to know if you have it, is that, remember I was saying that atrium isn't moving anymore, it's not squeezing? Well, it turns out there's a thing on the left atrium called the left atrial appendage. And blood can collect in there if it's not squeezing. And since it's moving so slow then in that little appendage, it can form a clot. Now, what happens when a blood clot leaves the atrium, gets into the circulation on the left side of the heart, and shoots off into the body? Nothing good. That's how you can get a stroke. So one of the dreaded complications of atrial fibrillation is a stroke. So you want to know if you have atrial fibrillation. You want to know how fast it is. You want to treat it via medical attention, which may mean agents to slow the rate. It may mean using electricity or drugs to convert that atrial fibrillation back into sinus, or it may mean letting it be an AFib, keeping the rate under control with medications or other implements, and putting yourself on blood thinners to reduce the risk of stroke. So this is why knowing that you have atrial fibrillation matters. There's lots of risks for atrial fibrillation. We can talk about this another time, blah, 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 blah. So how does this watch potentially help? Well, if it's monitoring your heart rate, it can tell you, hey, bro, atrial fibrillation alert. Something's going on with your heart where it's irregular or it's fast or whatever their algorithm's using to detect it, and that algorithm better be good. Then it can warn you, and you can seek the counsel of a physician. Obviously, you're not going to try to self-treat unless you know you have atrial fibrillation and your doctor has given you an algorithm like, okay, if you go into AFib and it's fast, take an extra pill of diltiazem or whatever it is that you're doing to treat your AFib. So that's why you really want to know. Now, question one is, FDA apparently has said, okay, we know from our discussion of the documentary The Bleeding Edge that FDA is quite lax when it comes to medical devices. And if they're shown to be substantially similar to other medical devices, then they will approve it through the 510K pathway. I don't know how it was approved because it's over the counter for Apple. So this is question one we need to ask as clinicians and healthcare people. What was the approval process for this? How reliable is it? What's the sensitivity of the watch for detecting this? So if it's really good, in other words, if it detects most AFib when it happens, then people can tend to rely on it somewhat. If it's not that sensitive, if it only detects like egregious irregular heartbeat and it misses the subtle stuff, people can be lulled into a false sense of security, particularly if they have known AFib, and think, oh, I don't have AFib or I'm in sinus because the watch tells me. That's the danger. And then you're missing out what, potentially getting medical attention. Now, the truth is they're going to miss that AFib anyways. So, because it's not, unless they're paying attention to their heart rate and they're checking their pulse and that kind of thing. So that's one issue that really needs to be sorted. But if it actually works, my feeling is this is another adjunct to partnering with your clinical team and understanding the nature of whatever it is that's going on with you in terms of your heart. If you have longstanding AFib, this can be a tool. For example, my dad has atrial fibrillation. Now, he detects it because the minute he goes into it, he knows it right away. He feels the palpitations, feels the skipped beats, maybe gets a little lightheaded, that sort of thing. So from the atrial fibrillation standpoint, this watch is really interesting because it is the first foray I think Apple's done into an actual managing an actual medical condition, which is atrial fibrillation. I'm encouraged that this may be very useful. I'm also very worried that people are going to put too much reliance on it, that they're going to misinterpret the data. If there are false positives, In other words, you don't have atrial fibrillation, but maybe your heart's going fast because you're exercising, whatever, and the watch picks it up as atrial fibrillation. You're going to create panic, anxiety, and a lot of calls to the doctor that didn't need to happen, in which case now we're dealing with Apple's poor technology. So that's another concern. Now, I think only time will tell, and I think it's going to take a lot of doctors using this and supervising patients and seeing what's actually happening. But I'm glad they're working on this. I actually think this is important. This is very different than a Fitbit where you're just getting data and using it to kind of change how you walk and this kind of thing. And many people, they call it a Quitbit because you're not really, most people give up. They don't have a good use for the data. In this case, there's a good use for that data, theoretically. The second thing that the watch does is it apparently, because it has an accelerometer on it, actually, you know what? No. Let's talk about the other part of this. So the watch normally just checks pulse through an optical measure, all right? But what it does now, the second subpart of the AFib detection, is that it has a little wind-up thing, a little fake wind-up crown, and then the sensor on the back, and it's actually a bioelectric sensor. So if you touch the crown and turn on the function that says ECG, it will take what is effectively a lead one arm EKG reading. So you hold it for 30 seconds, and according to the demo that I just saw, Apple's announcement, it will take a lead one EKG for 30 seconds that you can save, presumably share with your clinicians, that sort of thing. Now that's really interesting on a couple levels. One is if patients complain that they're having lightheadedness, pre-syncope, in other words, feeling like you're going to fall down, those kind of events, or they feel palpitations, they could effectively have a kind of ghetto Holter monitor, one lead monitor right here on their arm that they could check a tracing and email it to their doctor. That is fascinating. Assuming the quality is good, we could theoretically avoid, in theory, we could avoid a lot of big workup in ERs and a lot of admissions and a lot of extensive Holter monitoring and testing and things like that. In theory. In practice, if it's not sensitive, if it doesn't work well, if people have privacy concerns, which I think are stupid personally, you really, you know what, here's the thing about health stuff. There are some stuff that really should be private, but like whether you have an arrhythmia, assuming we don't get rid of the pre-existing conditions clause in the Affordable Care Act, I want people to know what's going on with me. I don't want there to be barriers. They don't care whether I have AFib. Like no foreign government, no hackers care. Even if I have a scalding case of herpes, I don't care. I just want to be managed and treated, right? But that's me. What do I know about herpes? So this EKG function is fascinating because it takes anything a Fitbit and all that does to another level. And again, FDA approved as the world's first over-the-counter ECG device. Now that's interesting because now you start to wonder, well, is this something that could really transform our ability to manage more things as outpatients, empower patients, give them data that's useful that then we can partner with them to parse? Or is it just going to create more work sorting through the noise? And I think time will tell, but these are the things we have to wonder about. So the last thing this watch does, and let me read a couple comments because I think someone was complaining about my microphone being too loud. Ouch, my ears, mic again. Ghetto Holter, Paul Zainsworth, who is a supporter. It's a ghetto Holter, right? A Holter monitor, you know? Okay, those are the only hopefully the sound's okay. So all that, I see Vanicream. Yeah, Vanicream's great for the dry skin. My wife likes it. And then we've got some avocado oil and some bananas. It's not what you think. The third thing that this Apple Watch does is it has an accelerometer on it, and they studied a bunch of people, according to Apple, and they found that when people fall, have a mechanical fall, I'm presuming they're talking about a mechanical fall, like a trip, a fall off a ladder, a stumble kind of thing, not a syncopal event where it's you're losing consciousness because you have no blood pressure. Because that's a different type of fall. When you have a mechanical fall, it turns out arms, if you're slipping backwards, arms go up, And if you're falling forwards, wrists and arms go out. So there's an acceleration of the wrist that's wearing the watch, which then can detect very quickly, oh, okay, because it'd be a quick acceleration and then a deceleration when you hit the ground, and then presumably a lack of motion. So it can then use algorithms based on actual falls that have happened and say, you know what, I think you've fallen, at which point it loudly says, we've detected that you may have had a pretty hard fall. If you don't do anything, if you don't move in a minute, we're going to automatically call your emergency contacts and 911. Now that is an interesting device, especially for older people, but also for younger people, because falls, especially unwitnessed falls, are a huge source of morbidity and mortality worldwide. So now the question is, the false alarms, like what happened with the emergency SOS button on the iPhone, they were calling 911 around the clock because of how easy it is to accidentally trigger that. That's the problem, is the false positives. But for those false positives, if you get a real positive, an older person who's wearing the Apple Watch, by the way, old people hate Apple devices, but if they did fall and they're wearing this expensive watch, it could theoretically save their life. It could save the horrible complications we see from unwitnessed falls, everything from subdural brain bleeds to rhabdomyolysis from muscle breakdown, from being flat on the ground for a day or two before you're found, dehydration, kidney injury, other problems that happen from unwitnessed falls, urinary tract infections, sepsis, terrible things we see in our older patients coming through ER and into the hospital, where I then take care of them. So this may be a way to, I've fallen and I can't get up, but it actually automatically. Now there are other devices I think that are more regulated that can do this, but this is the first, to my knowledge, it's the first over-the-counter device, and correct me if I'm wrong, that may do this. So I think in summary, one of the questions that I would have is, again, I want to see the data as to what are the actual sensitivities and specificities in a real-world population, because I don't know whether they've studied it in that way. I'd love to see that primary data. I'd love to get one of the Apple docs on the show to talk about this in a non-markety way, but in a true, like, okay, this is how this is going to help people, right? And as a device for older patients, AFib, falls, these are huge in our increasingly aging population. Could this be a transformative thing? It's not going to be long before others do this, and I hope they do, because there should be competition. People shouldn't be stuck with Apple devices. But let's read some comments now and see what you guys think. So, no more life alert, I've fallen and I can't get up. Gabriel Latham, who's a supporter. Gabrielle. Gabrielle, I think this is what Apple's game plan always is. Other people do something in some kind of fairly, interesting and innovative way, like Fitbit. Then Apple waits a while and goes, okay, that seems to be working-ish. Let's do it better and on a device that everybody has. And then they just destroy the competition. So I think that's their game plan in health. They didn't rush into health right away. They waited, they watched what's going on, what works, what doesn't work. They have doctors on their team, some of whom went to Stanford with me as residents, and are now trying to get in that game when they're ready to do it. Now, hopefully their strategy works, because I want to see, and then other people compete. I want to see these devices out in the world. I personally don't wear a watch because I have a phone and it tells me the time. But if I had a concern about my health and this thing could actually monitor, like imagine if it could detect seizure activity and call an emergency contact or 911 if that's how you set it, or if it could detect low blood sugar in a diabetic or very high blood sugar in a diabetic in a real-time way with the right technology. There's so many different sort of ways that you could, low blood pressure in a continuous way. By the way, tune in tomorrow live. We're going to be doing a show out of Irvine with a company that is creating real-time continuous blood pressure monitoring in the OR setting, where you can prevent hypotension before it occurs through predictive algorithms. And we all know the downside of having hypotension, especially in the OR. Then they come out to me with complications. So this idea of using technology again to acquire data, use some form of AI to parse it, and then serve it up in a way that's digestible and actionable for us is a key thing. All right. Someone's saying I have an electronic popping sound every few minutes. That means that I'm never going to use this piece of crap mic again. I hate technology, people. Anyways, hit share, hit like, become a supporter, be a part of the Super PAC, and tune in today. We'll do a show out of Studio Z. Check out the Apple stuff. Tell me what you think, and we out.